We are all aware that the strike that was called by the doctors via a court order by Justice Brian Ongaya on 15th of March. The strike was suspended, and for the sake of those who did not see the order, that was item number 6 on the court order, or order number 6, which says, for avoidance of doubt, the strike notice reference number KMPDU LT 125-2024, dated 6th of March 2024, and any strike following therefore is hereby stayed or suspended to allow the whole of nation approach now instituted as well as ongoing negotiations and reconciliation to seek to arrive at a lasting reasonable solution to the current instant dispute. Meaning that the strike that has been there for the doctors, those who are on strike are in defiance or they are disobeying court orders. And therefore, as a county, we have no choice but to take the necessary action against any medical officer, any specialist under KMPDU who purport to be on strike that is protected. We'll take the necessary action on them, which I will say in a few minutes. Secondly, on the issue of the clinic officers and the lab technicians, I want to report to the people of Tharaka Nithi and Kenya that Tharaka Nithi County, through the legal department, went to court, and on 10th of April 2024, we have received a court order by Justice Onesimus Macau. That order, or that court, has given us an order that has suspended the strike for the clinic officers up until we have had our talks and further directions have been given by the court. For avoidance of doubt, that is order number 2, that says that pending hearing and examination of the application, the strike called by the respondents via the notice dated 25th of March 2024 is hereby suspended forthwith, and interested parties directed to report to the duty station latest Friday 12th April 2024 and resume their duties. That was yesterday. 11th was yesterday, isn't it?
Yes. Yeah.
So they were asked to go to work as per yesterday. So we have no issue with those who are out of station up to yesterday. If you're a clinic officer and you're out of station in Tharaka Nithi yesterday, 11th of March, we have no issue. But today, 12th of April, any clinic officer who will not be on duty in Tharaka Nithi County will receive we have instructions to take all the necessary disciplinary action that are taken by the employer to employees when they abscond or absent them from their duty, and by law is only supposed to be 24 hours. And therefore, for the clinical officers and the lab technicians, we are not giving any ultimatum to report to duty. Any officer of that cadre, clinic officers, laboratory technicians, who will not have reported to duty today by 8 in the morning will be facing disciplinary action that may lead to suspension. I have asked my officers by next week, the number of officers who will not have reported to duty, we must advertise and replace them, because there are very many who are willing to work in Tharaka Nithi County and other parts of the country who are jobless and do not mind the terms and conditions that have been given. For avoidance of doubts also, I want to take this opportunity to advise the lab technicians who are working in Tharaka Nithi and Kenya that to date we do not have any recognition agreement with any union of lab technicians, and therefore this one, if you are out of duty pretending to be on strike, then you are totally misadvised, and somebody has just misadvised you to just run away from your responsibilities and therefore sucking yourself from the duty you earned one time when you are employed. I'm reliably informed that we have nutritionists in Tharaka Nithi and also in Kenya from a union calling itself Kenya Union of Nutritionists and Dietitians, that is KUNAT, who are purporting to have given a strike notice. Again, we do not have any recognition agreement with such a body, and therefore if they decide to go on strike after the days that they have given over, then that after 24 hours be considered as desertion of duty, and will again replace them. I'm also informed that we have public health officers who are also purporting to do the same. Again, we do not have any recognition agreement with public health union of any sort. The farm technologists, I am told they are also following suit. Those ones follow under the same with the ones of the lab technicians, and therefore we don't expect to be out of station. For Tharaka Nithi, for avoidance of doubts, allow me to say the following. One, we have recalled all medics who are on leave back to work today. So if you're a doctor, if you're a clinic officer, you're a nurse, if you're a lab technician or a technologist or pharmacist, and you're on leave in Tharaka Nithi, that leave has been suspended and you've been recalled back to duty because duty needs you. So those who will not have reported back to work and you are on leave by Monday, unless you're on sick leave, then we'll assume that you've also deserted duty and will take the necessary actions that are supposed to be taken. So please, all officers who are on leave and you're a medic in Tharaka Nithi County, please report back to your facility or a medical facility where you work. Secondly, I want to take this opportunity to give all the doctors who are on strike in Tharaka Nithi an opportunity to right the wrongs. We had already started the disciplinary action based on the court order by Justice Kongaya, but I have given them an ultimatum and also an opportunity to redeem themselves. And therefore, I have given them Monday, 8 o'clock as the least time they can report back to work in Tharaka Nithi, and we'll consider whether we can forget the 31 days they have been away from the working stations. Because we are human, we understand sometimes they can also be agitated. They may be having expressions or things to express as far as their terms of work are concerned, but they have already made their points. So Monday, 8 o'clock, any doctor who will not be on duty in Tharaka Nithi can consider themselves to be already in the roller coaster for the disciplinary action that may lead to full, not suspension, but termination of their contract with us as employees of Tharaka Nithi County. It's as simple as that. Lastly, for those who have been very worried in Tharaka Nithi about the services being offered by hospitals, I want to stand here today as the governor of Tharaka Nithi with my team behind me and confirm to the residents of Tharaka Nithi that all our medical facilities from the dispensary to the level 5, that is Chuka Hospital, are fully open and operational 24/7. Those who have been avoiding going to hospitals thinking they will not get doctors or officers to attend to them, please seek medical assistance from our facilities, because we have enough officers of goodwill who are treating our patients with decorum and respect, and they give them the service they deserve. So we are fully operational. Do not instill any fear in our patients by having them go to expensive private facilities that they cannot afford or going out of this county. Please attend our hospitals because we are fully operational. Thank you.